Because it's a full day, let's get right to it. Our midnight census was 450 patients. To date, Bryan has administered 11,577 COVID tests. Our positives are 1,522, and we have 247 pending results. So John will come up, Lisa, video, and then questions. Thank you.
Thanks, Bob. To give you the statistics on our COVID positive patients in-house, we have 12 currently. 8 are from Lancaster County, 4 from outside of the county. 5 individuals are on ventilators, 5 are in our ICU, 1 in our PCU or progressive care unit, and 6 inside of our general care. You know, a while back we talked about our maintenance phase. So we have a hotline that people could call into that was 24/7 at a period of time. We dialed that back to 7 in the morning till 11 at night. But just from the volume of calls coming in, we've elected to reduce that again to 8 in the morning until 4:30 in the afternoon. Individuals call in for questions, but also call in if they're looking for results. We have people dedicated that as soon as those results come in, be it positive or negative, we're reaching out to those patients because we know they're anxious to hear their results. The other thing is if you do have a MyChart account with Bryan, you can check that as well if you've had tests done to see the results. So that change will be going into effect, and we will adjust it as we see volumes occur differently. So if we happen to have a lot of tests come in for a period of time, we will stay past that 4:30 to make sure we call and contact any individual that their test has been returned. There will be an answering machine on that as well. So if you do want to leave a message, you can leave a message and we'll get back to you if you're calling for results or wanting some additional information. With that, I'm going to turn it over to Lisa Vail.
Good morning, everyone. Lisa Vail, CNO. I'm going to give you a couple of updates about the support and care of our COVID patients. During this entire COVID-19 pandemic, as Bob said, one of the most difficult things for family and staff has been the restriction of family presence at the end of life. We've been sensitive to these additional stressors and have developed a program that will allow for compassionate visitation at the end of life for up to 2 individuals. As of Friday, June 12th, we now offer what we're calling compassionate visitation for patients who are at the end of life who are COVID positive, COVID-19 suspect, or patients who have tested negative but remain symptomatic with fevers and other issues. This compassionate visitation process must be initiated by the primary physician caring for the patient. Eligibility includes patient is at the end of life or decisions need to be made about potentially withdrawing care. And the patient could also be on maximal support, including ventilators or special medications to support blood pressure and other situations, and yet they still are continuing to decline in their status. Due to the fact that visitors will have to be in full protective equipment, personal protective equipment, or PPE as we call it, and are not usually used to this, we are going to limit the length of the visit to about 1 hour actually in the patient's room. The length of the entire visit at the hospital may be longer, perhaps up to 2 to 3 hours, as we coordinate a time for the families to have a face-to-face conversation with the provider if possible, as well as allowing time for them to properly put on and take off their protective clothing. Our staff will be available to answer questions and provide emotional and spiritual support as needed. Visitors must meet established eligibility, including negative COVID status. They must be without a fever and the absence of any other potential COVID-19 symptoms. Those are the same types of things that we screen all visitors for when they come to the organization. They also have to be able to tolerate being in this PPE, and that includes a face mask, a face shield, gown, and gloves. How it will work: visitors will be met at the front door after a phone call has been made to coordinate when this visit will occur. So the staff will come down and meet the family at the front door and then escort them up to the clinical care area. As I may have said, up to 2 individuals are going to be allowed to visit together at the same time. Knowing that many families would like to have more than 2 loved ones during this visit, we will coordinate and facilitate additional connectivity through FaceTime and other technologies so that you may connect with the family, with your loved one during that actual face-to-face visit. Each family member who enters the dedicated isolation unit will have an assigned support person with them from Bryan. This individual will remain with them to ensure while they're in the room that the personal protective equipment remains intact and that there are not actually any potential breaks in isolation practices, because we want to keep our visitors and the families very, very safe when they go into a positive patient's room. Following the visit, the assigned support person will assist in removing personal protective equipment, ensuring the safety of our visitors. Additionally, at the conclusion of the visit, we'll provide time for a family debriefing with the staff or perhaps a chaplain as desired for answering questions and providing additional support. So again, this program is active now. It is initiated at the request of the primary care physician, and so that is how we will try to facilitate these really difficult times and support our patients and their family as your loved ones are facing the end of life. One of the other things that I just wanted to share is that we now have a Catholic priest from the Lincoln community on staff as one of our PRN or as-needed members of the chaplaincy department. This will allow for spiritual support visits and the provision of the sacrament of the sick and dying for our Catholic patients. So we're really excited for that as well.
I am Lauren Hawkins. I am an occupational therapist, and I have been helping take care of COVID patients on the acute inpatient rehab floor. When the patients first came to the inpatient rehab floor, they were extremely debilitated, had very little endurance and muscular strength, and so we started with the basics. Just working on sitting up on the edge of the bed, because when you're on a ventilator, you're pretty much laying down or you're prone on your stomach. Then we were able to get into standing, and then we were able to work on maybe standing at the sink and shaving, and then we're able to progress to walking to the bathroom. So just taking those little steps, hitting little goals along the way. So kind of just going back to the basics and then going from there was the best way. Anytime we do therapy with somebody, we always want to include their interests or what makes them happy, or what do they want to do, have to do, need to do. So somebody who's 74 and retired, their interests and hobbies are going to be a lot different than the young girl who's in her 20s and 30s who may have a child to take care of or may still be trying to get back to work. So just incorporating those different things, but still overall going towards the same outcome for independence. Our average length of stay for general patients is about 2 weeks, and so we're finding out just a little bit extra time is what they're needing to go home. When they're coming from the ICU, we're finding that their self-care, so their ability to take care of themselves, has been lowered. Their level of independence and even walking and standing is gone completely down, just from the prolonged time on the ventilator and just being in the hospital in general. Our goal with inpatient rehab, just speaking from my point of view, is to get patients as independent and safe as possible. So it's not expected that they'll be back to normal when they go home. A lot of patients are going home with home health care to continue working in their home environment. So it's not expected when they leave the hospital that their journey is done and their therapy is done. It's gonna continue for a while before they get back to what they consider their normal. It's such a feeling of accomplishment, and that, okay, even though this has been so hard, working in a pandemic, our lives have completely changed working in healthcare. but we totally made a difference in his life, and we helped him get back and meet all of his goals that he wanted to do. And it's excitement. Not a lot of tears from us, just more joy.
No, it has not been used here for quite some time, so that withdrawal of emergency use is not impacting any of our changes at this time.
We do allow end-of-life visitation for non-COVID patients. We do make some different accommodations for the size of the family and the members who can come in and the amount of time that they can come in. We do ask that those conversations take place with the patient's care nurse so that we can coordinate that and have proper notification in our visitor management system so that when those individuals enter the front door, they know, the greeters at the front door know that they've been given permission to come in. But we do allow end-of-life visitation. It's not as restrictive. It is, of course, for the hours between 5 a.m. and noon, but we also make special accommodations for other hours of the day, depending on what's going on and the number of individuals who need to come in.